What happens when you make this mistake after a snake bite? Imagine you're walking through a forest trail. The weather is perfect, everything seems normal. Then suddenly, you feel a sharp pain in your leg. You look down. A snake has just bitten you. Your heart starts racing. Panic takes over. Someone nearby shouts, "Quick, cut the wound open." Another person says, "Suck the venom out before it spreads." It sounds logical. It sounds like something you've seen in movies. But what if I told you that this single mistake could actually make the situation much worse? What if trying to suck out the venom or cutting the wound could increase tissue damage, infection risk, and delay the treatment that truly saves lives? Today, we're breaking down exactly what happens during a snake bite, the dangerous myths that refuse to die, and the life-saving steps every person should know. Excited? Stay until the end because one simple action in the first few minutes can dramatically improve a victim's chances of survival. Let's begin. Part 1. What really happens during a snake bite? First, let's understand what occurs inside the body. Not every snake is venomous. Many snake bites are harmless. However, when a venomous snake bites, it injects venom through specialized fangs. Venom is a complex mixture of toxins. Depending on the snake species, venom may damage tissue, destroy blood cells, affect blood clotting, paralyze muscles, attack the nervous system, cause breathing problems. The moment venom enters the body, it begins spreading primarily through the lymphatic system and eventually into the bloodstream. This is why movement becomes dangerous. The more a person moves, the faster venom may spread. Common early symptoms include pain around the bite, swelling, redness, tingling sensation, anxiety, sweating. More severe symptoms may include difficulty breathing, blurred vision, nausea, vomiting, dizziness, rapid heart rate. In serious cases, venom can cause organ damage and become life-threatening. Part 2. The biggest mistake people make. Now let's talk about one of the most dangerous myths in survival history. The idea that you should cut the wound and suck the venom out. This advice has appeared in movies, television shows, and survival stories for decades. But modern medicine strongly advises against it. Here's why. Mistake number 1, cutting the bite area. People believe cutting the skin allows venom to escape. In reality, the venom begins spreading almost immediately. By the time you make a cut, most venom is already moving through tissues. Instead of helping, cutting the wound can cause severe bleeding, damage nerves, damage blood vessels, increase infection risk, create additional tissue injury. You are essentially turning one injury into two. Mistake number 2, sucking out the venom. This is another Hollywood myth. Research has shown that sucking venom removes almost none of it. In fact, you may introduce bacteria from your mouth into the wound. If there are cuts inside your mouth, venom exposure becomes possible. More importantly, you waste valuable time that should be spent getting medical help. The most dangerous thing isn't the venom itself. It's delaying proper treatment. Part 3, what you should do instead. Now let's discuss the correct response. These steps can save lives. Step 1, stay calm. This sounds simple, but it's extremely important. Panic increases heart rate. A faster heart rate may help toxins circulate more quickly. Take slow breaths, stay as calm as possible. Step 2, move as little as possible. Movement is the enemy. Walking, running, or excessive movement may increase venom spread. If possible, lie down immediately. Keep the bitten limb still. Think of it like a broken bone. The less movement, the better. Step 3. Immobilize the limb. Use a splint if available. Keep the affected arm or leg stable. Avoid unnecessary movement. This can slow venom transport through the lymphatic system. Step 4. Apply a pressure bandage, only when appropriate. For certain venomous snake bites, a pressure immobilization bandage may be recommended. The bandage should be firm, not so tight that blood circulation stops, not like a tourniquet. The goal is to slow lymphatic flow, not block blood flow completely. Improper use can be dangerous. Step 5. Remove jewelry and tight clothing. Swelling can occur rapidly. Remove rings, watches, bracelets, tight footwear before swelling makes removal impossible. Step 6. Call emergency services. Snake bites require professional medical evaluation. Do not wait for symptoms to worsen. Seek emergency care immediately. Antivenom may be necessary depending on the snake species and symptoms. Part 4. Should you take a photo of the snake? Many people ask, should I try to catch the snake? Absolutely not. Never risk a second bite. If it can be done safely from a distance, taking a photo may help experts identify the species. But remember, your safety comes first. Do not chase the snake. Do not attempt to capture it. Do not try to kill it. A photo is useful. A second bite is not. Part 5. Dangerous things you should never do. Let's quickly review actions to avoid. Never cut the wound. Suck out venom. Apply ice directly. Use electric shocks. Drink alcohol. Attempt risky home remedies. Use a tight tourniquet. Waste time searching the internet for miracle cures. The most effective treatment is professional medical care. Nothing replaces that. Let's remember the life-saving rule. If someone is bitten by a snake, stay calm, lie down, move as little as possible, immobilize the limb. Seek emergency medical care immediately. Take a photo only if it can be done safely. And most importantly, never cut the wound. Never suck out the venom. These myths have put people at risk for decades. Knowledge saves lives. If you found this video helpful, hit like, subscribe, and turn on notifications for more doctor-explained survival and emergency health content. And please, share this video with your friends and family. One day, this information could help save a life. A snake bites you. You panic. Someone immediately ties a super tight rope around your leg. Sounds smart, right? Wrong. This common survival trick has actually caused serious injuries and permanent damage. Today, I'm revealing why this dangerous snake bite myth refuses to die and what you should do instead. Stay until the end because one simple mistake could cost someone their limb. What people think happens. Most people believe a tight tourniquet stops venom from spreading. The logic sounds simple. Block blood flow, stop the venom, save the person. Unfortunately, the human body doesn't work that way. Venom often spreads through tissues and the lymphatic system before a tourniquet can help. Meanwhile, the limb below the tourniquet starts losing blood supply. And that's where the real danger begins. The hidden danger. When blood can't reach muscles and tissues, they begin to die. The longer the tourniquet stays on, the greater the damage. Possible complications include severe tissue injury, nerve damage, permanent muscle loss, infection, loss of limb function. In extreme situations, doctors may even struggle to save the affected limb. The victim survives the snake bite, but suffers lifelong consequences from the treatment itself. What to do instead? Here's the safer approach. Step 1, stay calm. Step 2, Lie down immediately. Step 3. Keep the bitten limb still. Step 4. Remove rings, watches, or tight clothing. Step 5. Call emergency services. Step 6. Get to a hospital as quickly as possible. Remember, movement spreads venom faster. Staying still can buy valuable time. CTA, 4:30 to 5. Never trust everything you see in movies. A tight tourniquet can turn a bad situation into a disaster. Share this video with friends and family. One day, this knowledge could save someone's life. Subscribe for more Doctor Explained, Survival, and Emergency. Thanks for watching, and I'll see you in the next video.